We're back, and it is time for Live Healthy MD with Dr. Francisco Jacome. I'm excited about it.
Thank you.
I really want our viewing audience to know that I share my journey with being over 200 pounds. For them to know that, God, that was 27 years ago.
Wow.
That I was over 200 pounds, that it is possible to transform your life, and that's what you and your colleagues do.
Yes. So it is important to know, number one, that there is nothing to be ashamed of.
Yeah.
It requires effort to lose weight. It requires effort to change your life. That is something that is not easy.
Right.
Regardless of the avenue that you use to be able to do it, it requires a lot of effort.
Mm-hmm.
There are several ways of doing it, but the only thing that actually carries a long-term success is changing your life around. Doing a diet for a couple months and then going back to your lifestyle, it will not create a long-lasting change.
No, it won't. You yo-yo.
Yeah, that will just create the yo-yo effect. Different people need different kind of help, and motivation probably is the number one thing that is going to keep you going.
Yeah, most definitely. And I made a change. I've been vegetarian for 27 years. I don't drink sodas.
That's
and we
important.
talked before about the potatoes. I love potatoes.
Yes, they're
That
so
sound like
good.
Oprah. I love bread. Now, I love potatoes. But I know that potatoes don't love me.
No. I mean, those are simple carbs. Anybody that eats them enough is going to run into trouble,
Yeah.
especially trouble with health issues, diabetes, increased weight, and so on. We have talked already about, the different types of obesity, obese versus morbid obese. I want to mention a little bit about the treatment of them.
Okay, let's do that.
There are several ways that a person can lose weight. So number one, you can do a diet. I don't want you to get the concept of a diet where you find online and decided to do the grapefruit diet or one of those diets. When I mention a diet, I want you to understand that it requires a lifestyle change.
Yeah.
It's not only quitting what you're eating, but it's a lifestyle change that includes dietary changes, meaning what you eat, and also lifestyle changes like exercise.
Yeah.
Which is probably extremely important. So I want to mention that the two major treatments is just diet and exercise
Right.
versus surgical treatment.
Right, okay.
So when a surgical treatment is appropriate is when the person has lost total control of their weight.
Exactly.
Okay? There are very specific guidelines on when a person will be approved for surgery and when a person qualifies for surgery.
You just can't say, look, I want to have surgery.
Yes, no.
And then you
No.
say, okay, I'm going to schedule you next week. You can have your surgery. It doesn't work like that.
No, it don't work like that. When it comes to doing a surgery for weight loss, there is a very broad spectrum of surgeries and procedures that can be done that range from just having to undergo a procedure only with sedation versus having general anesthesia and having a complete surgical procedure.
Wow, okay.
Okay. The other spectrum is diet and exercise. So when diet and exercise is appropriate is when you have changed your mind. I do not say, okay, if your BMI is this or if your weight is this, your option is only surgery. The higher your weight, the more inclined that you should be towards surgery because it's going to be more effective than
Right,
just diet and exercise. Somebody that is 20 pounds overweight, a lifestyle change would easily get it back to
Remedy that,
normal.
right.
Somebody that is over 100 pounds overweight, then the story is different. Then the person is going to require more than just a lifestyle change because, like we talk about morbid obesity, which is being over 100 pounds overweight, will create your body to change. And once your body change, it's going to be extremely difficult to get it back to where it should be.
I want to ask you a question, though. I don't want to interrupt you. If someone comes and let's say that they meet all the qualifications for the surgery and they're diabetic, can you assist them?
Yes. Actually, one I'm going to just shortly mention, because we're going to talk more about this, is the surgical procedures, the actual procedures that we do to help people lose weight. Some of them can actually cure diabetes. If a person has diabetes type 2 and chooses to have a surgical procedure for weight loss, and we're going to mention those in the future, 8 out of 10 people are going to be cured from diabetes overnight.
That's phenomenal.
It's like a miracle. It's overnight. I'm
Yeah.
diabetic today, I get the surgical procedure today, I'm diabetes free tomorrow.
Wow.
And a lot of people don't know that.
Wow.
A lot of people, we even as physicians have a very good idea why that happens, but we don't truly fully understand the details of it.
Yeah.
But it's definitely a miracle.
Wow.
Bariatric surgery has shown to cure diabetes, cure blood pressure problems, cure sleep apnea, cure cholesterol problems
Wow.
in a very, very high percentage.
Yeah.
So it is important to understand that bariatric surgery is not the easy way out,
Right.
number one, because it requires a lifestyle change, it requires a procedure. Now, it carries a lot of benefits. The benefit of getting rid of diabetes, the benefit of getting rid of blood pressure problems, sleep apnea, and cholesterol.
And living better.
And living
And
better.
that's what it all comes down.
Exactly.
Well, you know, it goes back to this what you do in your practice. Live healthy, MD. So
Yes.
it puts you on that path to live healthy. I really appreciate what you do, and as I shared before we started doing this particular segment, I talk about my journey, because when I went back to the OBGYN for that follow-up, and she put in big letters, obese, I was like, oh my God, I become
Eye-opener.
another person.
Yeah.
I become another person. We're going to go to a break. We're going to come back from the break, and then we're going to do another segment a little bit later on. We're going to talk about some other things that you need to know, that there are options for you to live healthy, MD. Don't trust anybody. Now, I'm not saying don't trust anybody. I'm saying
Yeah.
I trust you and your team implicitly,
Thank you.
because I know people that have the testimony that their lives have been transformed. And I give an endorsement to Live Healthy MD, Dr. Francisco Jacome. We're going to take a break. We'll be right back after
you.
the break.
We